Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me in the studio today is Dr. Sarah Jane Camper. She is a doctor practicing at Mid-South in Dyersburg, Tennessee. Dr. Camper, how are you?
I'm good. How are you?
I am great. Thanks for coming in today. I really appreciate it.
Yeah, glad to be here.
So today we're going to be talking about building healthy habits for children. Now, I mentioned this off mic that I am not a dad, so I know very little about making sure habits are good for children to get into. So that's why you're here. Before we go into that, I want to learn a little bit about you. Tell me where you're from. Tell me what you do. Tell me some of your hobbies. Tell me about yourself.
So I was born and raised in Milan, so not too far from Dyersburg.
Good old Milan.
Yeah, bulldog at heart. And went to undergrad and medical school in Tennessee.
Okay.
And did my pediatric training in Chattanooga. And I'm glad to be kind of back home in West Tennessee.
Yeah, sure.
Starting up in Dyersburg. It's one of the new pediatricians coming in. I have a dog. She's
amazing.
A 50-pound lab. She's the best.
Yeah.
She's a little wild, but it's been fun.
Awesome. So I have a few questions, general information about how to build healthy habits for your child. So the first one is, what is the 95210 campaign? I've never heard of that. So when you sent that in, I was like, it sounds like you're talking about Dr. 90210 kind of
Yeah, it
TV
sounds
show.
like a zip code.
Yeah, it does.
So it started as the 5210 campaign, and then they recently have added the 9 to it.
Okay.
So it stands for 9 hours of sleep at night, 5 fruits or vegetables every day, 2 hours or less of screen time,
Okay.
1 hour of physical activity, and 0 sugary drinks. It's kind of just a way to remember kind of the healthy goals you can set for your child every day.
Beyond children, that sounds like a good idea for everyone to follow.
Yeah, no, and making any habits in your child's life and, making those healthy choices always works better if the whole family does it.
Sure.
So then they're kind of learning by seeing, learning by being told, learning by doing.
That's amazing. So can sleep really help kids be healthy?
Yeah, so a lot of studies have shown that kids who don't get enough sleep are typically overweight. And so it has to do with the way our hormone cycles are anchored during sleep.
Okay.
And so kids who don't sleep as much can feel more hungry. They can be more tired and irritable. Making sure they get enough sleep is going to help them make healthy choices and be less likely to be overweight, basically.
Gotcha.
And the 9 to 10 hours that this mnemonic is talking about is really for kids age 6 to 18. So younger than that, they need even more sleep than that. And it includes naps in the total sleep time. They don't have to be asleep for like 14 straight hours.
I was about to ask you if that included naps or not. Do you have a recommended bedtime for children, or does that kind of vary depending on the families?
So it really depends on the family. The AAP, American Academy of Pediatrics, had recommended moving back school times to 8:30. A lot of places, schools aren't able to do that for various reasons. And I know a lot of schools around here start at 8.
So a lot in Jackson start at 7, which is insane to me.
Yes, I cannot imagine being at school that early as a kid. But it really depends on the families. If they have to catch the bus at 6 a.m. and you're trying to get them 9 hours of sleep at night, they need to go to bed earlier. But if they don't have to be anywhere until 8, they can probably stay up a little bit later. It really depends on the family's schedule.
Gotcha. What recommendations can you give to families whose kids don't like to eat fruits or vegetables?
So the most important thing, I think, is making that fruit or vegetable available and an option. So kids, especially toddlers, it takes about 6 times of them seeing the fruit or vegetable to really know if they like it or not. So reintroduction, even if they're like, no, I'm absolutely not going to eat that broccoli, offering it to them, give it a week, offer it to them again is great. And then having it be fruits or vegetables that you as a parent eat. So if you are like, I hate broccoli, don't try to make your kid eat broccoli. They're not if they don't see you eating it, they're not going to eat it.
Right.
You know?
That makes sense.
And then having those family meals together where they see you, oh, mom is eating broccoli, so I can eat broccoli and it'll be fine. It helps. And then ways to kind of increase the number of fruits or vegetables your kid eat to get to that goal of 5 a day, kind of going slow. So change out one snack a day. If after school every day they come home and have a bag of chips, change that out for carrot sticks and ranch, or, apple or banana or something every day as a snack, and then slowly increase so that maybe both their snacks every day are fruits or vegetables.
Okay.
And then adding, make sure there's at least one vegetable on the plate at supper every day. It's kind of slowly increasing and changing that into a habit instead of an abrupt all at once. We're going to eat 5 vegetables right here, right now at 3 p.m., not leave until you get up.
Right.
Until you finish. Kind of
Right.
thing.
So you go to Kroger or to Aldi and you see those like dehydrated bananas, or the, I guess they would be dehydrated mangoes, like kind of like look like chips. Would you recommend those for kids? I know they're made out of fruit. Are they healthy?
So some of them can be healthy. Some of them have added sugar to kind of caramelize them. Those, you don't really need the added sugar. Eating a fresh banana is easier and probably cheaper than eating a bunch of caramelized, sugar-coated banana chips. Some of them that are just the fruit that's just been dehydrated, those are fine.
Okay. I was just thinking, like, if my kid were wanting a bag of chips, but I could substitute chips for the dehydrated mangoes that have the texture of chips, that might be I could be way wrong in saying I just don't know.
Yeah, no, absolutely. That's a great idea. A lot of kids, they make, like, carrot chips.
Oh, I didn't know that.
Having that to, like, dip in hummus or ranch or something is kind of a great step.
Okay. So what about screen time? I know a lot of schools nowadays provide tablets or laptops or whatever for their students. What would your recommendation be for screen time for those?
So the screen time recommendations and the physical activity recommendations kind of go hand in hand. So that's the reason for the limited screen time is because kids are spending more time sitting or playing on a tablet or a computer, playing video games on their phone, things like that. And I know a lot of kids have to do work on a computer or tablet for school.
Right.
And so the goal is to limit the recreational time. So playing 6 hours of video games every day after school, not a healthy choice.
Right.
But doing your schoolwork at home obviously is different. So limiting the recreational time on tablets or any type of screen to 2 hours so that they have that time to do the 1 hour of physical activity every day.
Okay.
Basically. And then with screens in particular, the blue light that just about every screen we have emits can mess with their sleep. So we recommend that they not have that blue light screen time at least 2 hours before they go to bed.
Oh, okay.
So that it helps with the circadian rhythm and falling asleep a little bit easier, so that when you're trying to put them to bed earlier so they can get their 9 hours of sleep to go to school, they aren't kind of fighting with that blue lights that they've just been on their tablet right up until bedtime.
So what should kids be drinking?
So the zero sugary drinks is sometimes tricky for parents, especially here in the South. Everybody loves their sweet tea.
Oh, absolutely.
But, the Gatorade, sports drinks, juice even, sweet tea, Cokes, obviously, all of that kids don't really need. It's just extra sugar. And so ideally, kids would drink, 1 or 2 glasses of milk a day, and then everything else would be water, basically.
Okay.
And that's really hard switch for a lot of, especially the older kids who've, got their drinks that they drink at school and everything.
Right.
And so, again, like the vegetables, going slow is really the best way to kind of accomplish that. Don't cut out everything cold turkey. It doesn't usually work.
Right.
But, instead of Cokes, try to get the water mix-ins that they sell at the store.
The Mio or the...
Yeah, Mio, Crystal Light makes some. Walmart brand has some that you just mix in with water. So the kids who are like, I don't like the flavor of water, that's why I don't drink it. That kind of eliminates that aspect. It makes it taste a little bit better for them. So you've cut out the Cokes, and then, slowly kind of cut out the sports drinks unless we're at a sports game or something.
Right.
And then, cutting out the juice except for maybe special occasions. It's not a never thing. It's just not an everyday thing.
Right.
For all the sugary drinks.
Okay. Well, Dr. Camper, this has been really great information to have. If you're living in Dyersburg and you need a pediatrician for your children, Dr. Camper is currently accepting new patients. And the phone number you can reach her at would be 731-287-4500, which is at MedSouth in Dyersburg, Tennessee. Dr. Camper, thanks so much for coming in today. I really appreciate it.
Yeah, no problem. Happy to be here.
Awesome. And this has been another episode of We Talk Health.